Hey, you guys. Let me fix my light a little bit. Hey, go ahead and come on in. Yes. I know I was supposed to come on here and do this at 1 o'clock today, but listen, the way I slept this morning, whew. So I do apologize for this being a late session. Go ahead and make your way in, you guys. Yes. All right, so I'm gonna give it just a few, maybe a minute, let everybody see that I am live right now. All right, so I'm gonna get started. If anybody pops in, has questions, I will answer them. So tonight, we are going to talk about bacterial vaginosis, the human papillomavirus, and pelvic inflammatory disease. All right, so these are the three for tonight. I'm gonna start with bacterial vaginosis. So a lot of times you hear this called BV. It is one of the most common conditions in women. This is something that's most common that women have. The age ranges are from 15 to 44. So yes, our teenagers all the way up to our adults. This is spread. We don't know. It is not known how this is actually spread. Really what it is an imbalance of good and bad bacteria. So you know, it could be a mixture of things that can cause this. It can be caused by having new sexual partners, multiple partners, douching. If ladies, if you don't know, douching is actually really not healthy for you. It takes away your good bacteria. So that can cause it. And in some cases, other STDs can cause this to happen. You can't get bacterial vaginosis from toilet seats, beddings, pools, things of that nature. And it's one of those viruses that can cause pregnant women to have premature and low birth weight babies. Now, some of the signs and symptoms, you could experience a white or grayish discharge, pain, itching, burning sensation in the vaginal area, fish-like odor, especially after having sex. You can experience burning urination when you pee. And you can experience itching around the outside of the vagina. So yeah, those are some of the signs of that. And BV, a lot of times now I've known there to have been instances where BV can be caused by non-sexual contact. So for example, if you are having if you're allowing someone to use their fingers or their hands to do things to you down in that area and their hands are not clean and dirty, that can also add to the cause of you having bacterial vaginosis. Hey Erica, did this video show up in the group, Erica? I'm just trying to make sure because I know it should have been in the group. For some reason, I cannot do anything else on my other page. I know for some reason Facebook has been acting really weird lately. All right, so that was pretty much bacterial vaginosis. Pretty cut and dry. Human papillomavirus, so HPV. HPV is actually, okay, cool. So HPV is one of the most common STIs. So you have what's called STD, which is a sexually transmitted disease. But a STI is a sexually transmitted infection. And with HPV, in 2018, it was actually about 43 million people had the infection, had the HPV. Most of them were teens and those in their early 20s. How is HPV spread? So HPV can be spread vaginal, anal, or oral sex. It's most commonly spread through vaginal and oral sex, and it can be passed with no signs or symptoms at all. So a person cannot even know they have it and spread it. HPV can go away on its own, but if it's not taken care of, it can cause someone to have genital warts and cancer. Now the thing with that is, when it causes the cancer, now a lot of people don't know every part of your body can have a cancerous name. So this can cause you to have cervical cancer. You can also have cancer of the vulva, vagina, penis, or anus. Okay. And it can cause you to have cancer in the back of your throat. And this would be mainly in like the base of the tongue or the tonsils. And that type of cancer is called oropharyngeal cancer. Oropharyngeal cancer. So basically throat cancer. It can take years or even up to decades to develop any of those types of cancers. So it's not like someone will have HPV and then, a couple months, they have cancer. No. This can take years, sometimes decades, before something like that happens. How do you avoid HPV? There's a vaccine. I know you guys probably seen commercials on TV. There's vaccines. They're encouraging parents to try to get their teens vaccinated for the HPV vaccine around 11, 12 years old, male and females. And even as old as 26 years old. Now, if you're over the age of 26, they're not really recommending it. There have been some instances where people are getting the vaccine past the age of 26, but it's very rare. There's no actual HPV test. So there's really no way for them to know and just do a test and say, oh, you have HPV. And there's no approved test to find HPV in the mouth or the throat. So that's something you want to make sure you know as well. And most people don't know that they have it. And when they do find out they have it, it's because they've had a presence of genital warts. Okay? Yeah. So this next topic, this one is a little more in-depth. What do you think about 11 to 12-year-olds getting? Honestly, when it comes to the HPV vaccine, I actually encourage that. I just tell parents to research, talk to the doctors, ask questions. Because like I say, HPV is something that can happen. Like, there are teens and young adults that are, there have been cases where they're not even sexually active, but they're contracting HPV because, again, it is an infection. It's not a virus. It's a virus, but it's like a sexually transmitted infection. So, you want to, I would say, yeah, do it. Like my twins, they're 13. But my son, you know, with all of his disabilities, the doctor said, you know, it's optional. So, you know, I just say if you feel like this will be something that is going to help protect. I mean, the way I see it is our kids get other vaccines. They get, you know, the MMR vaccine. They get, look, funny I said that. Look, our kids get all of these vaccines. This is, you know, this is the vaccine charts. They're getting all this stuff already, you know, for polio, for MMR, hepatitis B, varicella. They get all these vaccines. We rarely question those. So, you know, I say if it's going to protect if I protect them, why not? All right. So then now we have, PID, pelvic inflammatory disease. So PID is caused by untreated STDs. So basically, you get an STD, you don't get checked out, you can, in the end up with pelvic inflammatory disease. And this is targeted at women. This is what happens for women, okay? Men are not getting pelvic inflammatory disease. 1 in 8 women with PID history have difficulty getting pregnant. So yes, with most STDs, if they are left untreated, they can cause you to have infertility. PID is an infection of the women's reproductive organs, often caused by having chlamydia or gonorrhea. Okay. Other non-STD infections can also cause you to have PID. How are people getting it? How do I get PID? Again, having an untreated STD, having more than one sex partner, having a sex partner who has other sex partners. If you've had PID before, it can come back. Sexually active and younger than 25. Douching. Okay, you guys, ladies, douching is not good for you. Stop douching. If you are going in the store and buying Summer's Eve douche, stop it. Your body cleans itself naturally. When you douche, you are removing the good bacteria. And having an IUD, not just the fact that you have an IUD, but in the first 3 weeks of getting an IUD, you are susceptible to possibly having PID. And that's just only because that IUD is being placed in the uterus and it can irritate that area. How would you know if you had PID? You would have pain in your lower abdomen. You could have a fever. Unusual discharge with bad odor. Pain or bleeding while having sex is also one of those signs. Burning while urinating. And if you have bleeding between periods, that can also be a sign of possible pelvic inflammatory disease. Now, what should you do if you experience any of those signs? You want to call your physician immediately to be examined, and to also have them to do an STD panel. Okay, if diagnosed early enough, it can be treated. Now, if there's any damage that's caused from the time that you get PID to when the doctor tells you have it, any damage caused in that time frame cannot be undone. The damage is done. And then also, if it's left untreated, you could form scar tissues on the outside and on the inside of your fallopian tubes that could leave you to having tube blockages, which means infertility. Ectopic pregnancies, you know, when the egg basically implants itself in the tube. Because that blockage is there, it can't move any further. And it can also cause long-term pelvic and abdominal pain. So that is our 3 for tonight. I know that it's 7 o'clock. Some people are probably still getting off of work. Some people are still probably, you know, school hours, especially if you're on the West Coast. It is still probably about, what, 4 o'clock that time. So this replay will be here for you guys to watch. I will pin it in the group. I will also be posting this to YouTube. So you will be able to watch it on both places. All right. So again, tonight I've discussed bacterial vaginosis, human papillomavirus, and pelvic inflammatory disease. If you have questions, you can post your questions in the comments. I will answer them. I will guide you to references if you need them. And on tomorrow, let's see, tomorrow we are going to be talking about, now everybody's ready for tomorrow. So tomorrow at 1 o'clock, I'm going to be on tomorrow at 1 o'clock. So be ready. Syphilis, hepatitis, and trichomonas. I got a lot of people ready to hear these three be discussed. So make sure you tune in tomorrow, 1 p.m. Eastern Standard Time. All right. We are going to discuss those three, and then we have 4 on Friday that we'll discuss. So thank you guys so much with working with me with all these Facebook issues that are going on. I greatly appreciate it. Again, if you have questions, please ask them. And thank you so much for watching and listening. You guys have an amazing night, and I will see you tomorrow.